Hello everyone, this is Tae Kwon from Keene, New Hampshire, and this is your Ripe Global Implantology case review. And I would like to share a case of Cheryl today with you. Cheryl was referred to my practice several years ago for evaluation of gingival recession, or I should say peri-implant mucosal recession around maxillary canine. And then you can clearly see there is mucogingival deformity with no attached tissue, and threads of the implant is exposed clinically. And you can also see plaques around them. A lot of time when you see these implants with buccal threads exposure or peri-implant mucosal recession, a lot of time that means implant fixture was placed too buccally. And when implant is placed too buccally, it does not leave enough buccal plate, or even it leave only thin buccal plate, which is going to resorb eventually and cause peri-implant mucosal recession. From the scientific study, it is recommended to have at least 2 millimeters of bone buccal to the fixture in maxillary arch. Now, in a case like this where the interproximal bone is intact, I always like to treat these cases not with a bone graft, but with gingival graft first. The reason is growing the alveolar bone or growing the bone outside of the normal alveolar housing, especially when you already have implant fixture, is extremely unpredictable in my hands. And I do think this is related to avascularity of the implant threads, obviously, which are metal, but also the metal threads are all contaminated. So when you put bone graft in, which is already dead in nature, because when you use the bone graft, they are usually dead bone, you cannot really grow something dead around something that is dead. So I always like to correct this with soft tissue, in my humble opinion, which is much more predictable. So the way I approach this case is first, I prepare the recipient bed like I'm doing with free gingival graft surgery. And after I remove the epithelium around the implant, I kind of gently clean around the implant threads with saline and scalar. And then after that, I take free gingival graft from the palatal donor site and then place it over the area, stabilize the graft with stitches, and you can also see there is what I call as a compression suture, which adapt the graft against the implant tightly so that there's no dead space. And the graft is actually coming from the palate, but you can actually see there's something different from regular free gingival graft. In regular free gingival graft, you will harvest the tissue away from the gingival margin, but in a case like this, I would like to take some tissues that is around the palatal marginal gingiva, because that's the tissue that somehow survives around natural teeth, even though they're not attached to the teeth. So I want to actually use that that marginal gingiva and then transplant it over the exposed thread to see if that marginal gingiva can survive without too much vascularity. So this is 4 weeks after, and you can clearly see that full coverage of the implant threads were achieved. And let's look at how things are healing. This is 4-week follow-up on the palatal donor side. You can actually see the tissue healing is looking really good. And this is 3 months. So you can clearly see the tissue is continuously maturing. And this is 3 months follow-up. And at this point, the underlying connective tissue healing is completed. So I was able to put the probe in safely. And you can clearly see the probing depth is about 3 millimeter or so. So this was really nice. A nice result has been achieved. And this is 3 months on the donor side. And I saw her for 36 months. And you can clearly see nice result has been maintained. And probing depth has been maintained very normal. Thus, we did not need any additional procedure. Yes, one may argue that we might be able to do some bone grafting to see if we can add some particulate bone on the buccal threads of the implant. But when there is no periodontal pocketing and the peri-implant mucosa appeared healthy, there's no reason to intervene with more surgery. So the principle of regular or conventional periodontal surgery, including gingival graft, can be applied when you're dealing with implants or implants that are ailing. And this is why in our fellowship in modern implantology, we heavily focus on management of the soft tissue around dental implants. If you want to learn more about it and then you want to do gingival graft like periodontist around natural teeth and implants, please join me at Fellowship in Modern Implantology. Thank you very much, and I'll see you later.